it is really expected that there might be some wait time. That's the first thing.
Hey, everybody. In this episode, we are going to talk about autism. Autism spectrum disorder is a developmental disability that affects social skills, communication, and behavior. My guest is my friend and colleague who, who I've met in 2017 when we became diplomates of the Philippine Pediatric Society. She is Dr. Sheryl Kho. She's a developmental pediatrician who trained at St. Barnabas for her pediatrics training, and she did her fellowship at Rhode Island Hospital. And she's currently practicing at her main practice is at St. Luke's Hospital in Quezon City. A lot of parents wonder about autism when their child does not make eye contact or tiptoeing for some and speech delay. We start by welcoming my guest, Dr. Sheryl. Hi, She.
Hi, Tin. Hello, everybody. I'm so happy to be here. Thank you for inviting me and very excited to discuss and, touch upon questions of our parents or other concerns that we both encountered in our practice. Thank you so much for inviting me.
Of course, of course. So, what can a child or parents, what can they expect during an autism assessment?
So first of all, it is really expected that there might be some wait time. That's the first thing. So
Uh-huh.
appointments, developmental assessment, they don't, there's no walk-in.
All
Kumbaga,
right.
no, because everybody is scheduled, because every patient that doctor sees takes time. So assessments can occur anytime, anywhere between an hour to 1.5 hours. So it's very important that the developmental pediatrician, or like for example, speaking of myself, to have a schedule. If not, we will not be able to see all patients in a timely manner. So please expect that there might be a few months of wait. Now
Mhm.
that depends and that varies from one doctor to the next. So after you have the appointment, you will come, no, to the appointment date,
Uh-huh.
and basically the important information is gathered from the parents, no, because the child sometimes cannot express themselves, and the child is the child, so of course hindi naman talaga fully conversant sometimes or kayang mag-explain. But the importance of having the parents there is they're the ones who are sharing what they observe with the child. That's the first thing. The second part of the assessment is the developmental pediatrician's observations as well of the child, because
Uh-huh.
the child is now there freely roaming around or playing with the toys, right? So everything that the child is doing, the pediatrician, developmental pediatrician, is we're keen, no? We look at every little thing that they do,
Uh-huh.
find clues to support the parent's history, right? To support or to find out whether, for example, may autism ba tong batang to, o
Mhm.
kumusta yung eye contact niya. So ganun talaga siya parang ka-detailed. And then we do developmental testing, right? Or developmental screening.
Uh-huh.
The testing, the purpose of that is to figure out, okay, what is the developmental ability of the child? Is it according to their age, or may delays ba yung bata? To help us understand the skills of the child. And in an autism evaluation, you can have different results of developmental testing. Sometimes they don't want to participate, untestable,
Okay.
kasi not cooperating
Uh-huh.
yung bata. Ganon. Second, yung iba naman nakaka-cooperate, pero syempre sometimes because of their limited abilities, they do have delays in their developmental results. And then other times yung iba naman at par naman with age, or kaedad rin nila, same age yung development. So the results of developmental testing don't they can pass that, they can fail it, or sometimes hindi sila mag-test. But that doesn't mean wala yung autism. Iba pa rin yung diagnosis kasi ng autism sa developmental testing. And then after that, syempre, we talk to the parents about the findings, kung may autism, tapos kung ano yung mga questions nila, yan yung mga sasagot. Kaya humahaba yung appointment
Right.
up to an hour and a half. We can entertain all the questions because, di ba, Tin, honestly, mahirap naman talaga makatanggap ng diagnosis ng
Right.
autism
Oo.
because we both know that it's a lifelong condition and it's something that can really influence the growth of the child and up into adulthood. So very important yung first meeting,
Mm-hmm.
yung diagnosis, action, 'di ba? After that, ito na yung ating gagawin. So ganun siya kahaba.
Right.
So, continuous. So, that's why, it's also important to be prepared, no? Kasi sometimes, I think parents, one thing that they can be prepared for, di ba? Kasi pag what to expect is to really have, if they can list down, maganda
Uh-huh.
yon
Uh-huh.
yung nakalist yung mga concerns nila, list yung mga questions, para talagang no stones left unturned. Lahat nasagot, or at least lahat nabanggit, di ba?
Right.
So, yun. Ganun yung mga assessments.
Right.
Kaya medyo at maano siyang usapan.
So, for example, yung kasama nila is more the yaya or the caregiver. Do they also come with the during the assessment? Can they come?
So, depende yan, I think, sa doctor preference, I would
Uh-huh.
say. I have a big clinic naman. So, maraming opportunity for social distancing, lalo na ngayon sa COVID-19 situation. I
Uh-huh.
do appreciate, ako personally, like for example, sometimes kasama si lola, si
Uh-huh.
tita, hindi lang yung magulang, tapos minsan meron pang mas matandang kapatid, gano'n, or yaya, or kung sinong nag-aalaga. I appreciate kasi sometimes busy si mommy,
Right.
yung lola yung may alam, or caregiver may alam, 'di ba? So, nakakatulong kung merong ibang other point of view rin.
Yeah, kasi mas matagal na kasama sa bahay yung yaya, for example, kasi nasa work yung mom, right?
Tama,
How about
tama.
before the appointment? Do they fill out forms? Do you have them do that first?
Um, Puwede, so either it can be emailed or ako personally sa clinic na lang when they come in, I ask them to come maybe 10 minutes ahead,
Mm.
para lang mag-fill out. It's a quick questionnaire about basic information lang. So, kung meron pang additional depende sa history, dun ko na lang pinapasagot minsan. Pero mga 1 page, 2 pages lang, hindi naman napakaraming papeles.
Mm-hmm. Okay. So, you said you mentioned at the end of the appointment, you make an assessment already. So, right there and there, the parents would have an idea. So that's
Yes, most of the time.
most of that.
There are
Okay.
times, yeah, there are times din that it's not a clear picture or
Okay.
parang may autism but not really meeting the criteria. So at that point, I also explain to the parents why I have not come up with a diagnosis,
Mm-hmm.
ganon, of autism.
Mm-hmm.
So I explain why. Tapos yung parents also, yung pala, hindi naman pala, baka delayed lang. So may times ganon yung case. Pero pagka-clear naman yung case na may autism talaga yung bata, from observation history lahat, talagang na-meet yung criteria, ay talagang diretso talaga yun madadiagnose.
Okay.
Gano'n.
Okay. So how can parents reach you if they want to seek consult?
So I have a Facebook page. Okay, first of all, you just type in my name, Sheryl Kho, period. D as in dog, B as in boy, P as in papa, DBP, SherylCo.dbp. That's
Mm-hmm.
my Facebook page. Andun yung clinic information ko. I'm mostly at St. Luke's, Quezon City. Okay? All visits by appointment lang po. And then I also have some other clinic locations I go to once or twice a month. Meron sa Parañaque, meron sa Bulacan, and sometimes in Davao even, although recently
Oh,
yeah, oo. Although medyo recently hindi masyadong consistent yung schedule ko doon. Pero consistent ako sa St. Luke's, Quezon City. So I have a shorter appointment time there.
all right. Thank you so much, She.
Welcome. Happy to be here and happy to share what I've experienced as a doctor.
If you like that video, watch my next video where I teach you about other child health problems.